Hello and welcome to Health Talk. I'm Dr. Manny. About 700 women die each year in the U.S. from pregnancy or delivery complications. As a high-risk obstetrician, these rates more than alarm me. America's maternal mortality rates are not only high, they're rising. Today, we're joined by two people who know firsthand what these tragedies are all about and what we can do to help end maternal mortality worldwide. Ryan Hansen, who lost his wife 6 days after she gave birth to his son, and is now the founder of the Tara Hansen Foundation, and Dr. Mary Alvarez, a physician and executive director of Merck for Mothers, a program that's run by the American pharmaceutical company Merck to reduce the number of maternal mortalities throughout the world. Thank you so much for being here. Very serious topic. This is something that hits me right in the heart because this is my profession, and I know it is a problem. So I'm going to start with you, Ryan. Tell me about your story.
Yeah, absolutely. So my wife, Tara, 29 years old, healthy, active. This was our first child, and she had a great pregnancy. She was exercised throughout the whole thing. She really embraced it. We made all the doctor's appointments, read all the books, did the classes, everything you expect to do during your first pregnancy. And she gave birth, and we had a healthy baby. And soon after, she began not feeling well. We had some fainting issues and things of that nature, and she just got into this sense of general, I say, malaise or flu-like symptoms. She knew she didn't feel well. She knew her body shouldn't be as exhausted as she felt. She had pain in the delivery area and things of that nature. And that kind of continued to the point where she just really knew that something was wrong and we needed to alert our physicians.
And I know she died several days afterwards. What were the healthcare team telling you during this period?
So for us, the message we kept coming across was, you just had a baby. And of course we knew that, and we understood that Tara was going to be tired. She was going to have some soreness and things like that. But in her heart of hearts, she knew, I don't feel the way I'm supposed to. And I think one of the things we realized in that whole process is that we never necessarily knew how she should feel after delivery, but she knew that something was wrong.
Right. So, Doc, I'm going to just ask you one question. Why, if I look at the rates of mortality, the U.S. is going in this direction, the rest of the world is going in this direction?
Exactly.
Why?
Exactly. You're exactly right. A woman in America back in 1990 had a better chance of surviving childbirth than her daughter does today. In terms of why, there are many reasons. I think, one, we didn't recognize there was a problem. There has been limited data, and if you don't know there's a problem, you don't know why it's occurring, you don't know how to fix it. I think a second reason is because more and more women are actually pregnant at the same time that they have other chronic conditions, whether it be diabetes, high blood pressure, obesity, all things that increase their risk for maternal deaths. And we are also finding that these women are finding it increasingly difficult to receive consistent and coordinated care across their pregnancy. Thirdly, we know, as Ryan has shared, that we're not listening to women. So many hospitals are actually not prepared to deal with the emergency when it arises, whether that's because by the time they listen, it's too late,
right,
or they don't have enough training or practice to actually solve the emergency.
So I want to focus in three complications that usually are tied with maternal, morbidity or mortality. One is bleeding, postpartum hemorrhage.
Yes.
What should obstetricians and hospitals do? Signs and symptoms of that?
So most importantly for women is to recognize when they have severe bleeding. So if you're soaking your pad more than one every hour, or if you have a blood clot larger than a size of an egg, that's a sign that you need to seek immediate medical attention.
Right. The other one, which is common and we see it quite a lot, is the preeclampsia, which is the combination of high blood pressure and protein, which is a substance that gets excreted through the urine that shouldn't be, and swelling. How is preeclampsia being managed or not managed in today's hospitals?
So if you're having a severe headache, something that's associated with vision changes, swelling in the face, nausea, dizziness, those are things that you should bring to the attention of the medical team.
Another one that is also associated is embolism, which is a clot in your lungs, pulmonary embolism.
Yes.
What are the signs and symptoms of pulmonary embolism? In other words, clot in the lungs.
So with a clot in the lung, a woman can experience sudden shortness of breath, sharp chest pain, and often pain that's made worse by cough. They may also cough up blood or have some swelling in the leg.
Brian, talk to me about the program, because you really are a huge advocate to bring attention, and I applaud you for that. Tell me about your program.
I appreciate that very much. So we work closely with Rutgers Robert Wood Johnson Medical School, and we've created a Stop, Look, Listen initiative. So looking back to our experience, we realized that it was communication, for the most part, that enabled us or gave us the inability to really get that message across that Tara needed help. So we were never able to really raise the red flag, move the needle to the point where they said, this isn't routine anymore, we need to do a deeper dive. So we created Stop, Look, Listen. We look at it as a tool for physicians and patients. So we can say we have a Stop, Look, Listen event. I need more attention. I need my physician to stop and remove themselves from what they're doing and focus on me. I need them to look at the area at hand, and I need them to listen to all of my concerns. That, in turn, should be able to get a woman who needs help, the help that she needs, and that can really change the course of her care and create a successful outcome.
So, Doc, what is the program that Merck is participating with other, I'm sure, other pharmaceutical companies?
So Merck for Mothers is Merck's $500 million global health initiative to help end preventable maternal deaths. We work in 30 countries, and right here in the US, we are supporting different organizations to find better data, like the CDC, and help states investigate every death. We're also supporting and have supported over 300 hospitals to implement quality of care improvement mechanisms like safety bundles, and also community-based organizations to provide wraparound services. But what we're really excited about, and to your question about how do we spread and scale these efforts, because there are 50 states in the United States, and we all have to work together to solve for this, we've just launched something that's called the Safer Childbirth Cities Initiative. It's a $10 million call to action for local cities and communities to actually solve problems themselves, identify what's happening in their community, and what are the specific solutions for those communities.
Okay, well, thank you so much. Give me that phrase again.
Stop, look, listen.
That's right. Yes. Everybody should remember that, and every pregnant woman and husband or partner should learn that phrase. I think it's a wonderful phrase. Thank you so much for being here and telling your story, and of course, a great initiative that you're doing. And if you have a health question, send a tweet to Fox News Health. Until next time, I'm Dr. Manny.